What's the latest understanding of titer levels inside of the US and abroad? Is there a consensus on this meaning?
So I can start with that. MOG antibody testing is run in a number of established research laboratories, and the principles and the methodology are very similar between these laboratories, but the way that they identify titers and report them can vary from lab to lab. And each established research laboratory has a particular threshold by which they identify patients as being positive or negative, and their titers help them determine if they're low positives or high positives. So what we do know from multi-center international studies is that those patients who have high positive titers, there's fairly good correlation between the laboratories. What the meaning of a titer, so a single titer in a patient who's positive, is probably less helpful. What is quite interesting sometimes is looking at serial samples or serial longitudinal titers in a patient. The thought is that patients who have an acute episode at first onset or relapse have generally high titers, and when the patient is well in clinical remission, these titers might reduce. Some studies have shown that when patients become negative or seronegative, their risk of a relapse is lower, but this is not universally identified. I think the real challenge is what you do with those lower titers, those low positive patients. There's less agreement between the laboratories here, and that's an area that needs further research.
Dr. Banwell, anything to add?
So I think I agree 100% with what was just said. So the most important MOG test, in my view, at the moment, is the one performed close to the first attack. Done properly in a lab using a cell-based assay, and others on the panel can also speak to the assay biology and the importance of the correct test, is pivotal in the diagnostic phase. Some labs offer spinal fluid MOG testing. That is not the advised way to test from a diagnostics perspective. It may down the road have relevance in terms of severity of MOG or other important findings, but we don't know that yet. What we do know, and by we, I mean the whole community, is that there are patients who have clear positive titers in the blood, but are negative in spinal fluid. So if you only tested them in spinal fluid, you would miss the diagnosis. And that has definitely been an issue with patients referred to me who, for example, never had the blood testing done, only had a spinal fluid test sent. So I think it's testing matters, and a blood test at onset is pivotal.